Hello, this is Dr. Haley, and I just want to shoot this short video on auto accidents. I'm basically preparing for an auto accident. It sounds a little weird because you don't think you're going to get an accident, but we live in the New Jersey, New York area, and it's very high incidence of car accidents in this region, so we want to make sure you're prepared. What we do is we usually give every patient one of these. It's a brochure. It's auto accident. Be prepared. Now, I'm not going to post this anyplace because it's an office material, and I don't know if we could do that, but it kind of gives you a little bit of history. So you got to do a lot of writing. So you do this before any kind of incident, and you put it in your glove compartment, and you don't have to worry about it. It gives you all this information, because when people get in an auto accident, if you've already been in one, you understand. You don't know what's going on sometimes, especially if you've got significant injuries. It could be a head injury. You get scared, you get nervous, you're reaching for things, you don't know what's going on. So we recommend people fill out something like this, or even just on a piece of paper. Well, we start on one column here. I'll just go over this real quickly. Vehicle details. Write down your vehicle details. If you have to fill out a report, you have it, okay? You have it in front of you. Put down your repair shop. Your car's got damage, you're going to get it repaired, so at least you know what repair shop you're at least going to bring it in, if it's drivable the next day. Auto details. This is important. Get an auto diagram. What happened? A lot of times we'll get a police report, or you'll get a police report, and it'll be a little inaccurate. Who ran what stop sign, who did this, what angle you got hit in. You want to make sure, while it's fresh in your mind, what exactly happened. You also want to put down the other driver's information. Make sure you exchange information. You also want to put down any passengers in your car. You want to write them down, where they're from, their number. Some people are traveling with relatives, so it's a little easier, but sometimes you're just traveling with friends you just met. Okay, and if there's any witnesses, you write their information down, because sometimes if it's a little murky on the details, you need some witnesses. One of the things we have here, and I'll just read this through just like a checklist that it says here, but be prepared, have the accident kit in your brochure, we call it. You put it in your glove compartment, you have a little pencil, because you need stuff to write this going on. Get a copy of your registration, a proof of your insurance. This is stuff everybody should know. Also have a cell phone and a disposable camera. Why do you need that? Obviously, the cell phone, you could call for an ambulance, you could call the police. A camera. Take pictures of the damage, the car, and take pictures of the other car's damage, because once those cars leave, you may not be able to do that. Flashlights, it's always good to have in your car, and road flares, reflectors, especially if you're in a rural road, and have a first aid kit. Okay, you might have a little damage that you could treat at the scene there. If you have a cut and you're waiting for an ambulance, you may be able to patch it up. Other things that you have to do is stay calm. Check yourself and your passengers for injuries. Don't just lay there and be mad at the world. You have to assess your injuries and check your passengers. Call 911 if ambulance service is needed, and the cops. Some people don't do that. I'm amazed. I had a patient years ago that didn't do that, and it ran into all kinds of problems. Call 911. It's what it's there for. Turn off the ignitions of the vehicles, very important, so there's no fires, or you limit the chance of a fire. If the vehicles are drivable, it's very important, get them off to a safe spot. Sometimes I'll be driving on the road and I'll see there's an accident, they're right on the roadway. No, and I drive by and I'm like, they gotta pull over. You have shoulders for a reason, so get it in an area where you're a little bit more safe, okay? Identify the other driver and witnesses. We went over that. Complete the accident details. We went over that. Very important, because like I said, you get a police report later on, it could be totally different. And I've been practicing 32 years. I've seen, I can't even count how many car accident patients I've seen. But basically, sometimes you get it, like I had to go back and get the report changed because they totally got it wrong. So make sure you know the details while it's fresh in your mind. Also, photograph the scene like we talked about. Get the damage. Get the actual road conditions, okay? If it's raining out, have that documented. Also, there's a lot of commercials I see out there. I hear it on the radio all the time. If you're hurt, you need to contact a lawyer right away. Look, there's time for that. I know the lawyers might disagree, but the first thing, if you got injuries, get to the hospital, get them taken care of, get them documented, go see the chiropractor the next day or so, or go see the therapist or the doctor, whoever you choose to go to. But take care of your injuries first. Then you could always do the legal stuff later on if it's not your fault, okay? And then report the accident to your insurance company. Make sure they know. It's funny, because I still, even in this day where everybody kind of knows about insurance, they don't report it. And I'll have to tell the person, or the girls in my office will say, look, you didn't report this to your insurance. You have to do this, okay? That's one of the things you have to do. So we give this to the patient. and they put it in their car, they fill it out once, and they know about it. And it's good that they read it through. Like if you go to the back, it's really good. It tells you some signs and symptoms. Sometimes people don't think they're hurt, but here are some of the symptoms you might have and think it's minor, but it could be attributed to the auto accident. If you're feeling good while you're driving and all of a sudden you get in an accident, now you have things like a headache, nausea, fatigue, dizziness, fainting, or you're feeling weak. You get neck, shoulder, low back, arm stiffness, head, neck, shoulder. Your arms feel heavy. You start losing a little hearing in the ears, or starts to get a little bit of a ringing in the ears. Heart rate, you're excited. Okay, that's why it's always good to call an ambulance. They'll check you at the scene. Anxiety, irritability, insomnia. If you can't sleep, that's what happens. A lot of people, I'm okay. They go home, they can't sleep. Next day, they're in pain. Okay, or memory lapse. That's a big one because we sometimes overlook the brain injuries. So these are just things we give to patients. They put it in their car, and they don't have to worry about it. They read it once, read it twice if they want to do it, and they kind of know what to do in the event, and hopefully they don't, but they get in an auto accident. So either find this online or actually prepare yourself in your glove compartment, because the better prepared you are and the quicker you get to these injuries, the better outcome you'll have. All right, that's Doc Daly signing off. Have a nice day and drive safely.